Doctor, can you tell me why shingles tends to affect our older adults more than younger people?
It is a function of immunity. The magic light turns off at about 50 and you're prone to infections such as pneumococcus, influenza, and of course shingles.
Doctor, can you tell me why someone who has had chicken pox is at risk of developing shingles later in life?
The virus for chickenpox and the virus for shingles is exactly the same. The chickenpox is how a person gets it the first time. Pox will appear everywhere, and thereafter the virus will bury cells into the spinal cord and what they call the cell body. It comes out when your immunity is poor and it travels along the nerves and appears as a band on the shingles. So the rule is thus, no chickenpox, no shingles.
Okay. Doctor, can you tell me why shingles can cause long-term nerve pain? Now, this is even after the rash is healed.
When the virus comes out of the nerves and travels along the nerve to the front, it damages the nerves along the way. It's translated as something that's very distressing to you as a form of pain. But in some cases, the injury to the nerve is permanent, so you will not get recovery. So the moment you develop shingles, see a doctor immediately. Get the antiviral medication. It may help you preventing that forever pain in shingles.
Right. Doctor, can you tell me why some people who have the shingles vaccine still develop the disease?
Okay, so the vaccine is supposed to work 90% of the time, and this lasts on for about 10 years. However, 10% of the people can still get a shingles attack. Number two, your immunity might be really so much worse off than the average individual. 2 shots was not sufficient for you.
Doctor, can you tell me why shingles occurs on one side of the body, actually?
Simply because the nerves usually travels and innervate one side of the body. Nerves from the back or from the head will come out and innervate one side. They don't cross. And it is because of that peculiarity where it doesn't cross, then it tells you it is shingles.
Can you tell me why people with shingles will have to avoid contact with certain individuals, like newborns or pregnant women or, young kids?
You see the rash there is? Well, there is live virus there. We discourage these individuals from going out and meeting others because you can in turn spread the virus to others. So do your part, be a good citizen by not going out when you have shingles.
Doctor, can you tell me why shingles can affect areas beyond, just the skin, such as ears and your eyes?
Okay, so people can get poxes on the skin. We see them. But you can actually get pox in the mouth. You can get pox in the throat. And guess what? You can get pox in the stomach. You can get pox in the liver. Why? Because that's where there are nerve endings. As long as there are nerve endings, the virus can actually take it all the way there.
Doctor, can you tell me why post-herpetic neuralgia is a common complication of shingles and what can be done to manage it?
What it means is the nerve is damaged for a long time. And the pain goes on 3 months and after the shingles has ended. It is rather common because we are dealing with an older age group of people. Their immunity is poorer, and in turn, they're going to have more severe cases of shingles. More severe means that the nerve is going to be damaged even further, and they are more likely to get this post-herpetic neuralgia complication.
Alrighty, thank you so much for joining us on Doctor, Can You Tell Me Why?